Our panel speakers. Former Minister of Healthcare and Sports of Netherlands, AB Klink. Former Federal Minister of Health in Germany, Bahr. Philips Turkey CEO, Haluk Karabatak. Akfen Holding, Chairman of the Board, Hamdi Akın. Health Investment General Manager, Hüseyin İnceöz.
Hoş geldiniz. Bugün burada sağlık...
Welcome. Today we will be discussing about the future of health and new business models and the future health technologies, health investments, and what are the good practices, and we will be speaking about the further areas to be good practices.
So, he is the former Federal Minister of Health in Germany, and now he is member of Board of Allianz Health Insurance in Germany. Welcome on stage.
Thank you.
So, as you're closely involved in healthcare systems of many countries, in your opinion, how is it possible to establish a sustainable healthcare system with better performance levels? And what should be the vision of the countries for this?
Well, that's really difficult because we have to face that we see the same challenges worldwide, an increasing number of diseases, of chronic diseases, of people who suffer from chronic diseases or even from dementia. In every country we see increasing expenditure on healthcare costs, and the increase is higher than the increase of GDP or inflation. The medical inflation, for example, in Germany is about 4% per year, and it's higher than the regular inflation. And as I read, here in Turkey you have a medical inflation of about 16% per year, and it's higher than the regular inflation. So we all face the same challenges, and we all have to accept that in aging societies we have to spend more for healthcare. But that's the difficult question, because there is a conflict between expenditure for education, for infrastructure, and for healthcare. But the expenditure for healthcare should increase if we want to have healthy people, if we want to help people who are sick. And the problem is how to finance it in a sustainable way. In my opinion, it's necessary that we save money if we have a part of the premium. It's part of the premium you pay for insurance is saved for the higher costs in old age. And the second point is we have to get to better cost efficiency, because the healthcare market is not comparable to other markets which we heard today. We heard about infrastructure, we heard about information technology, we heard about telephonic market, but healthcare is so different, because it's not the demand who determines the supply. It's the other way. The supply determines the demand, and that's the problem. So we will see that we need more transparency, we need more cost efficiency. The insurance companies, the insurers, and the patients have to have more influence on perhaps the prices, on what they see, where is better quality, where is better treatment. We pay this, roughly, we pay the same amount for the treatment and don't look if it is better treatment, if it gets to better results. We pay the same amount for the same treatment without looking on the results, and that's not cost efficiency. And I think to get to a sustainable healthcare system, we have to challenge the system, we have to get to more transparency and to better cost efficiency. For example, a pay-for-performance approach. So we pay those hospitals better and pay more for their treatment if they could see and could argue with better results than others.
Okay, thank you. And Mr. Akfen, I mean, I just would like to take the same route, and I just would like to get your views on this one, because before going into the Turkey's challenges, I would like to get a Europe-wise view from your side as well. So from your perspective, what are the biggest challenges in healthcare for time being? And what may be the actions on which areas should be taken from your perspective?
Well, I think, to be honest, that the problems that, for example, Turkey, but also the European Union countries are facing are more or less the same. Although the stages of development differ, and I think it might be an asset for Turkey to be at the very beginning of building up, not the very beginning, but at least you have to make some progress in building up capacity. And if you look at the European countries and the United States, for example, you see that our biggest challenge is just to reduce the numbers of overtreatment and overproduction. As Mr. Bahr says, healthcare is not a normal market. It is very much driven by those who provide healthcare. And for example, if we look at our hospitals in the Netherlands, we had a program last years, and we just invited some hospitals to make a combination of delivering better healthcare and I have to say more appropriate healthcare, so that you're not overtreating patients on the one hand and saving costs on the other hand. And what we saw within these hospitals, that within 2 years, for example, was a reduction of hip replacement with 20%. And gallbladder surgery, it went down with 18%. And when we make an estimation of the costs that are connected to overtreatment and overdiagnosis, it's about 20% of the total amount of money that we spend on healthcare. And in Dutch standards, it's about 5 billion euros that we can save. And if you translate this, for example, to Germany, where overtreatment is even a worse problem than in the Netherlands, I think you can easily take out of the sector about 10-15% of the total amount of money, and I think that will be about 20 billion euros. And let's be clear, this is not only waste of money, it's also not beneficial for the patient. Yeah. Actually, being overtreated is harmful. So making an agenda of what Obama once called saving lives, saving costs is very worthwhile. And if you look at, for example, Turkey, but I will come on this issue. I will focus on this issue later. But once you are starting to build up your hospitals and your primary care, etc., and you don't integrate the risk of supply-induced demand, I'm quite sure you're going to pay far too much in the coming future.
Yeah.
And you're going to harm your people as well.
Yeah. Yeah. Okay, thank you. So, Akfen Holding Yönetim Kurulu Başkanı Hamdi.
Akfen CEO, I will be continuing with you, Hamdi Bey.
PPP modeli ilk defa.
PPP modeli ilk defa, for the very first time, PPP model has been used in the public hospitals, and 3 city hospitals have been constructed by you. On the investor side, what were the advantages of PPP model? Actually, hello everyone, first of all, welcome. First of all, when we look at the advantages of both sides, you know that the contract, the agreement, you have both sides. One side is missing. Hüseyin Bey, our general manager, is missing. If he was here, it would be very ideal to explain the situation. The state side and the investor side would be speaking out. So we have reciprocally signed an agreement, and according to this agreement, we need to look when we have started the negotiations. In 2003, we have started. Between 2003 and 2004, in the end of 2004, when Recep Aktaş was the Ministry of Health, and with the order of our Prime Minister, he was the Prime Minister at those times, we have started our investments. We have had some serial meetings, and we were aiming to develop those contracts. Both sides have worked how to develop these projects, and they have worked together. They have discussed it together, and during this discussion, there were the benefits of the state, the Ministry of Health's benefits, and the investors' benefits were also the matter of discussion. You should create a climate which is suitable for an investment. So, Ministry of Health has got a perception which we need to terminate. we do have some present hospitals, and it is something extra. The city hospitals are seen to be something extra. No, within the framework of the investment program of Ministry of Health, it is being included. If you are going to construct 50,000 beds within the investment program of Ministry of Health, since 2012, we have started until 2020, we need to add new beds per year. And the city hospitals is fulfilling this need. If we do not do it with PPP model, if we have not put our hand as the investors, the Ministry of Health would do it somehow from the budget. And Ministry of Health says that I do not want to use my budget. You use your own credits, and you find your own loans, you make use of your own balance sheet, and I'm going to rent the building which you construct. This was the first condition. Of course, there's an economical model for that, and the investor and site and the Ministry of Health have negotiated this. If we put this much as a loan, we are going to make use of our own capital, and we are going to make it bankable in this period of time. If we are going to take the loan from the bank, then we are going to shape it in accordance to that. And also repayment and also the rental costs have been determined. And this site has defined their own model. They have presented the opportunities. They said, I'm going to provide you this, I'm going to give you the rent, I'm going to give you the medical support, I'm going to do everything medical, the rest of the facility management will be done by you. Such type of an agreement has been undersigned. And of course, two sides of this agreement have taken it. We said, okay, I am giving you this guarantee, you are going to pay me the rent, but if you have a delay in the payment of the rent, what will happen, they said. So they have added an article, treasury guarantee has been added, or a similar guarantee has been added. So there was a reciprocal understanding, negotiation. As a result, in order to give credit, to assign a credit for such kind of projects, $300 million can be found somehow. But when you look at the total picture, it is $10 billion of an investment. The PPP project costs that value. Then you look at it from the investor side, such kind of things are taking place. And if you cannot carry on the administration, if you leave the, for example, construction in the middle, what am I going to do? Then organize it to take my whole building size. So we have seized the assets, and of course the referee side are the banks, EBRs, IFCC, or the other banks, and Turkey were the referees in between, mediators. If you provide us this condition, we will be giving you. If you do not provide it, we won't be giving. So the financial institutions were also a partner. We have had some advantage. The Ministry of Health was having some advantage, and it was clearly being defined on paper. The tendering process and right pricing. If you can find the right price, just as other businesses, it can turn into a disappointment. But if you find the right model, if you find the right price, it will operate, and these projects may be sustainable. Ministry of Health, as much as they can, they have provided ideal conditions. Of course, there can be some misunderstandings during the tendering process about the rights. There are still ongoing discussions. However, the projects are in progress. We have completed the Sparta in Eskişehir. By the month of June, we will be delivering. In Tekirdağ, it's going very well. We don't have any problem. As a result, Adana has been finished, Yozgat has been finished, and Weekend is going to be opened. Mersin has been opened. So everything operates efficiently, and the model has effectively worked. So we do have two types of income here. Let me tell it to you. The first one is we are constructing the building and renting it for the Ministry of Health. So we do have a rental price income. And with the Ministry of Health, for 25 years, we are working collaboratively. We are co-partners. Where are we? We are providing all of the needs of that hospital. What are they? Waste management, for example, gardening care and security, secretary services, food and beverage. Such type of services are being provided by us, and we are preparing the bill for that. like programming, for example, or X-ray, and placement of the X-ray devices and placing the MR devices, all of them do have some certain prices. So we have got an agreement. We are providing such kind of services. They're only bringing their doctors. In Sparta, 3 hospitals have been closed. 3 state hospitals have been closed. And all of the doctors from those hospitals, within a day, has been transferred to Sparta Hospital. And in Sparta Hospital, Sparta City Hospital, we have completed our 1 year, 2 days ago. 1.5 times more of the population have visited this hospital. They have applied to polyclinical services. As our previous speaker has just mentioned, there is an overtreatment, there is an over-service. Everybody in Sparta is visiting that, and whenever the president came and visited Sparta, he said, "What is the name of this hotel?" So he just teased us, of course. He just joked with us because it is hotel-like. The hospital is just like a hotel. So a person is having a headache, is having a stomachache. In order to see the hospital, they are creating something as an illness, and they're coming and visiting and seeing. And that's all I would like to tell about PPPs. The success of PPPs and also being successful in their implementation, and they are a reference point for further implementations, for further sites. Model is totally right. Without having any discussion, it is a perfect model. Do not misunderstand me. If you do have any misunderstandings, I can answer any type of questions. Every model actually can be transformed in the right way. Sometimes we have to find the right way when we are on the way. So we need to have a negotiation. We need to negotiate on prices. If we do have right pricing, then we may find the right way. If that pricing is wrong, if we allocate the right of the state to the state, if we allocate the right of the investor to the investor, then it may continue. Otherwise, it will be totally distorted. The system should not be distorted, should not collapse. If that system continues and becomes sustainable, we will always have a share from the pie. This means a higher level of employment, higher level of investment, higher chance of a labor force, and so on. And of course, the state will be benefiting from that. If it is the contrary, it will be totally collapsing within a few years. Many good models have been established in Turkey, but they have not been durable, they have not been sustainable. Thank you very much, Hamdi Bey.
We will be continuing with Haluk Karabatak, the CEO of Philips Turkey. So with regards to medical technologies, Philips is one of the companies who have important investments. We are all aware of that. So what happens in this sector right now, and what kind of benefits the hospitals and the patients are receiving from those technologies? First of all, hello and welcome to everyone. As you underlined in your speech, Philips as a company is operational in different fields and different sectors, home care products and also the medical technologies. Especially in the recent years, we have invested heavily in the medical technologies. Of course, the medical technologies are directly related with the advancements and the trends in this sector. In the world, we see 3 important trends, and those trends are actually being materialized in Turkey as well. One of them is the changing demography. The high level of aging is also brought about with the increase in the population. The average age of Turkey is 28, but if you take a closer look to the period of 2035, the Turkey will be aged 2 times faster than the European countries, and we will have the problems of the aging population. And when you say the aging population, the sustainability of the health care services is a huge problem, because the burden and the cost of the aging population on the healthcare services should be managed by the health directors and health directorates, and this is one of the most important jobs that the government should actually do. And the previous speaker actually mentioned that with regards to aging population and changing health needs, the high quality should also be provided. And another important point is the tailor-made healthcare services, and the awareness of the patients are actually increasing. Of course, in the future, most probably, in order to have less health problems, people will do sports much more and they will eat much more healthily, and this is becoming a general trend, and the awareness with regards to that is increasing day by day, and this is the second change. And the second change that we observe these days are that the technology, together with the fourth industrial revolution, with the smart technology and the artificial intelligence, technology started to serve those needs, and these trends will shape the future of the health care in 50 years. One of the breakpoints of the healthcare services is the usability of the medical technologies. And at the same time, the transformation should be taking place in the healthcare services. When I say this, what I mean is that in the morning session, if I'm not mistaken, the TED general managers speak about Airbnb having 1 million room. Airbnb is not only changing the lives of the tourists, but it is actually changing the lifestyle of the people, because in Amsterdam, for example, people are actually emptying their houses in order to serve for Airbnb. And your neighbors will be changing, because you will have neighbors who will be changing each night, and the social life will be changing as well. A similar change will be started to occur in the healthcare sector as well. So, in addition to the services that you traditionally demand from the healthcare sector, most probably healthcare sector will start to provide services independent from access to doctors and independent from the location, and the technology will be heavily used in those services. When you say future in the healthcare services, quality and the answers for such trends and the place of the artificial intelligence will be of great importance. Thank you. Thank you.
I would like to continue with Daniel Bahr again. So we see that issues and challenges in the healthcare system are similar in many countries. So how do you evaluate the healthcare system in Turkey? What could be your suggestions if you see some improvement areas?
To be diplomatic, because I'm not here to criticize Turkey, because I didn't like it when I was in health ministry in Germany, when someone came from overseas and say to us in Germany what we could do better. I don't know any healthcare system worldwide which is the best. There is no one. Every healthcare system faces the same challenge and faces the same problems. I think you could be very glad. I was surprised that you are aging faster than I expected, but you are still a very young population. So you could do a lot in Turkey to save money when you set the right incentives here in Turkey for young people to stay healthy as long as they could. Because the problem is the life expectancy is growing. But the problem is that a lot of diseases, like chronic diseases, where we had problems a few years ago, and those people with chronic diseases, of, for example, with HIV, wouldn't have a life expectancy they now have with medical treatment. But that costs a lot. So I think you could invest in infrastructure, you could invest in incentives to stay healthy as long as people could. As I look on the data, you spend, I think, more than 5% or roughly 5% of GDP. That's really a cheap healthcare system in comparison to our countries. We pay more than a double of that. So my opinion is you have to invest in the right incentives to stay people healthy. For example, diabetes or COPD is not a problem for health insurance. I'm now board member of Allianz Health Insurance in Germany, and I'm responsible there for claims management. Our problem should not be a diabetic person, because we know when he when he focused on his sickness, when he focused on his diabetes, and he lives together with diabetes, he controls his blood sugar. Very often he goes to the doctor. He focuses on a healthy food, on movement and so on. He's not a problem. He's not a cost case for us as a health insurer. So we have to do more for those chronic diseases to help people stay healthy. And that's also a role of a health insurance, even in Turkey. I know that Allianz, Eileen, our CEO here from Allianz Turkey, which I know very well and is very successful here in Turkey, Allianz is one of the biggest health insurer here in Turkey, and we discussed the same problems. How to get people to get to better compliance and adherence of a patient. Because if we set incentive, if we give transparency, how to live with diabetes, for example, we could all together in the population and society save a lot of money. I would invest, if I were you, in e-health, in infrastructure and information technology, because I think there is a huge potential to save money if we connect hospitals with doctor and hospitals together. Better way, we could change information and we could save money because we get the patient to the right specialist very fast. We could get better results if we compare hospitals and look which hospital is better for which treatment. For example, if you compare the error and treatment rate of hospitals, or we could collect all the data and we get ideas which is responsible, for example, for a bad result if we compare those data. And there you have much more chances than we have in the Western European countries, where we pay a lot of money for healthcare, but it's not sustainable. We pay, as Klink mentioned, we pay, in my opinion, much more than we should do, because we have inefficiency. And you are in a starting point in this healthcare system. You could invest in the right way. So I think when I heard it, I think PP models are very good. You also could do more, in my opinion, in e-health, as I mentioned, and you could do more to say people they need to invest in their health. For example, in insurance or in fitness programs and wellness programs, in sharing data to get to a healthier status.
Okay, thank you. And Mr. Akfen, the question comes to you as well. So, how do you evaluate the healthcare system in Turkey comparing to other countries maybe, and what are the strengths and weaknesses that's in your perspective?
Well, I think I have been reading some of the reports of the OECD on the Turkish developments in healthcare, and it's amazing what you achieved, I must say. Building up primary care, building up hospital facilities. If you look at life expectancy, it has really enlarged. So I think you really did a good job. But just a couple of remarks on digitalization and prevention. I think digitalization will come definitely, because it is these technologies are so brilliant, and they will enter the market. But I want to also warn for some side effects which will, in the end, I think be bad for people and might be very costly. Maybe just because many people think, and the assumption is that in healthcare it is the earlier you know, the better it is. So big data and knowing what's going on in your body, etc., might be beneficial for patients. But let me just give you one example. There are many of them. Of what happened in South Korea, for example. There they started a kind of a screening program on thyroid cancer, so cancer nearby your throat. And within a couple of years, there was an enlargement of about 800% of people who were diagnosed with this kind of cancer. And if you look at the mortality rates or morbidity rates, there was no difference. So many of these people, most of these people were being diagnosed, although they wouldn't have been sick when they would not have been diagnosed. And I think the big issue in big data and acting on the assumption that you'd better know as early as possible and it's a marketer for all those people who come with all these devices, etc. In the end, might be very costly and devastating for the patient. One other remark on prevention, I very much agree with what Daniel Bahr said about, for example, the people with diabetes. We are running a program nowadays in Holland on lifestyle, and people who eat healthy, have a different lifestyle. They can skip the medication. They even can skip their insulin intake. So in the end, they don't cost us any more. But we are investing in these kind of programs as an insurance company. I'm working for an insurance company nowadays. But in the end, the costs are going up instead of down. And it's quite easy why this is the case, because once a patient doesn't go to the hospital anymore, the hospital is not going to say, well, I'm going to fire some doctors. They are just filling up the capacity and doing more and just over-treating more. And so we are investing in prevention on the one hand, and on the other hand, the cost within healthcare stay the same, so we are paying twice. So you need to, of course, that's no plea from my side not to invest in prevention, but be aware that immediately when you start with these kind of programs, you have to know what the business case is and what the costs are within the complete chain of healthcare. Otherwise, I warn you, you're going to pay twice, also in Turkey.
So preventing is everything, I guess, because, I mean, in order to not to invest that much huge money, we need to proactively prevent something.
Yeah, but then you also have to reduce the capacity in the sphere of hospitals, GPs, etc. Because be aware, every doctor, which is not, well, let's point to the American wisdom. Every bed there is will be a filled bed. There's no hospital, there's no doctor who says, well, nowadays I see less patients, let's scale down my facility.
Yeah.
They don't. You have to enforce them.
Well.
And then you have to know the business case.
Yeah. Okay, thank you. Sayın Hamdi Akın.
Mr. Hamdi Akın, let's continue with you. City hospitals are quite important in our lives. According to you, inside of the healthcare sector, do you think that the city hospitals will pose certain differences in terms of the technology, or is there any other differences that the city hospitals are presenting? Well, there are many differences that the city hospitals are presenting. Of course, the patients are encountering with an entirely different hospital. They are huge. They are very big, first of all. They have the we will have the bed capacity of 3,500, for example, Bilkent City Hospital and Etlik City Hospital. So it is just like a city, as the name suggests, and the social life will be inside of the hospital. And of course, not only the inside of the hospital is different, but the outside of the hospital, there will be an ecosystem which will serve as an appeal center. The roads of the hospitals are also quite different. Maybe you had a chance to pass by Bilkent in the capital in Ankara, and new roads are being constructed for the access to the hospital. And in order to not have the traffic jam, people are trying to solve those problems in terms of an access to the hospital. And at the same time, let's assume that 50,000 or 100,000 people will come to the hospital, which might be the capacity that the Atatürk Airport is attracting. So we are trying to open shopping malls and the shops there so that they can actually buy. So, I mean, these hospitals have many different things that the 100-bed capacity hospitals do not have. Of course, the technology is totally different in those city hospitals. The devices and the cutting-edge imaging technologies are being used, and the operating theater devices are also present. But since we are buying in bulks, we are buying those devices from GE, from Siemens, and from Mitsubishi. You can think of any company, the new devices are actually being presented to us, and they are actually marketing to place their new devices to these city hospitals. And when the Ministry of Health is asking for it, we are buying them. Of course, these city hospitals will serve for a long time. That's why we have to actually have the cutting-edge technology, and many devices which are not present in the traditional hospitals are present there. Of course, these hospitals are totally different. I'm not sure whether I would like to go to a big hospitals, because there will be certain challenges, because in order to access the things in the small hospital is quite easy, because if you visit a small hospital for 2 times or 3 times, you will know all of the doctors. But in these big hospitals, then in the city hospitals, the relationships will be much more formal between the doctors and the patients. So there will be this institutionalization process, and this means that we will step into a different and new world. But it doesn't matter from which perspective you approach to the city hospitals. I believe that city hospitals will lead to maybe 6 hospitals to be closed down. Their lands will be actually the places for unearned income, but maybe the treasury will actually receive another income to use it for the rental payments, and it will contribute to the treasury, to the budget. So this concept, the city hospitals, should be discussed with different perspectives. It is not only about the size, and this is not my topic. This is actually the topic of the doctors, medical doctors, that they can discuss about it. We are the investors, so we are actually discussing this issue from the financial perspective, and we are actually interested in the facility management, because this is our responsibility. But the medical side and the patient treatment is under the discretion of the Ministry of Health. In addition to that, I also would like to say, in quotation marks by the way, in order to eradicate certain prejudices, some of the people are claiming that the certain guarantee with regards to the number of the patients have been given to those investors, people are saying, no, there is not such a thing. For example, we provide catering services, and there are at least 3,500 beds in the hospital. Together with the doctors and the patients, you will be serving to 10,000 people. So how many, what will be the amount of the food that you have to produce? And the Ministry of Health has to define actually a target. And the Ministry of Health might say that, okay, the limit will be the 7,000. And if it is below the 7,000, anyway, I will be paying you the price for 7,000. Such kind of guarantees should be there so that we can actually prepare ourselves. This is not actually a guarantee, by the way, because if they do not give us a number, a statistics, then we cannot actually do the cost management, and we can actually prepare less food. And when the food is, when we are out of food, then we will say we are out of food, and that will be a disaster. So we have to have certain guarantees, but these guarantees are for our general costs. There is no guarantee for the number of the patients. For example, in the airports, everybody is speaking about the guarantee for the number of the passengers. Yes, there is such a guarantee, but we didn't receive any money from the state, not in Istanbul, not in Izmir, not in Ankara, because we always receive more passenger than the guaranteed level. As a result, when you serve to the number of people over the guarantee, it goes back to the state, because they actually keep the guarantee at the low level so that they will not pay extra money. So guarantee is not something very bad. It is facilitating our financial structures. But the most important thing here is to find the price. If the guarantee is at the very highest level, then the state will be paying out of its pocket. But if the state can actually define the guaranteed level in the optimum point, then it is something right, and it will actually facilitate the finance, and the state can actually have the upside of it. I would like to explain this situation because there was a lot of prejudices.
Mr. Karabatak, in the health technologies, what do you expect? What new technologies are going to come, and what will be the processes and the progresses for the future? Taking a look to the health technology, it's a very fast path actually, and Philips is abiding by those rules very quickly. So when we are talking about this transformation, we need to be dwelling on the matter. For instance, like the ultrasound devices are very well known by each and every one of us. It's like this size, and it's a very heavy tool, and you can use it only in the clinics. Whenever you need it, you can go to a clinic or you can go to a medical center and you can use it easily. So for the time being, when we say that we have an ultrasound that is as small as a mobile phone, and if you can actually use it in your pocket, and after you take the screening, if you can actually send that screening to any part of the world, to a doctor or an expert, think about that. Or to another clinic or another hospital, or we are talking right now a borderless, a spatial place, but these systems are talking with each other. So there is the diagnosis and the proof and the evidence of this, and this is where we are going right now. So we are independent from the space with smart technologies that are talking to each other and supporting each other and that are related with each other are the new technologies which will actually transform the new health systems. For instance, with AI, the artificial intelligence, it is very probable to find out the solutions for the acute diseases, and it's very easy to understand it through medical technologies and different types of devices. So this is what we are talking about right now. The progress is here. So the health world will be very much different than we know it today. Think about the operation rooms. Wherever a doctor is, think about that. He is in Ankara or in Bursa, in a hospital, and he can make actually the operation that is going to be happening in, for instance, the United States with the robotic technologies. So this is where we want to be leading to. Another important dimension of this technology is that it is very much related with the PPPs, like the city hospitals. Philips in city hospitals is very much prominent. And so far, all the city hospitals, mostly half of the city hospitals are buying Philips devices, because this high-tech, the cutting-edge technologies should not be limited only with the hospitals. Rather than giving the service in one space, actually the mobile and these devices can continue from outside the space. You can make your follow-ups and monitoring at home, and you can support it with these devices, and it can be very much bounded with the hospital itself. So you can give better service to the patient, a better quality to the patient, and on the other hand, the clinical results will indeed be much more successful than before, and productivity will rise. So Philips, on the other hand, has a certain type of a vision as such. What we intend to do here, as I said before, we need devices that are talking with each other independent from the space, where you can reach any type of an expert from anywhere you are. So this is the world what we are expecting. In health technologies, there are plenty of things that you can do, and most of them are indeed particularly going to be supported with legislation. So most of the services that have been landed at the time being doesn't have any kind of a legislative infrastructure, but I'm sure the legal authorities in the next coming future are going to fill those gaps and follow and support for the solution of these supporting devices.
Mr. Daniel Bahr, I would like to get your comment on how would you see the hospitals will be like in the future with using all those technologies and innovations?
I think they will change a lot because, as you mentioned, it's fundamentally right. Information technology will play a big role. And for example, we have a lack of doctors in the Western European countries. I don't know the situation in Turkey, but perhaps it will become the same. And then you need the doctors from other cities to work in a hospital in rural areas, for example. That's possible. We try it in Germany. I think the doctor's role will change. He's more an enabler. He's more a control person. He's not that one who sees the patient every week or every month if he suffers from a chronic disease. Perhaps he could control himself if the patient uses an app. For example, we as Allianz Health Insurance in Germany pay for diabetic person an app, My Sugar, where he could write down his blood sugar date, and the doctor in hospital could see the development of the patient and could decide whenever he wants to see them. So it's not the hospital in the future is not the same like today, where you go when you have a problem and you will treat in the hospital. It's more perhaps a portal clinic, we will say, with doctors in a network. It's more an ecosystem. You have to build a network as a hospital.
Thank you very much. As the time is over now, but I mean, we were good in timing. Thank you very much. And I think we have discussed all the technologies that we are using now in healthcare system and how will it be look like in the near future. And we have discussed our challenges. And thank you very much for all of you for all your comments.
Your contribution, thank you, we appreciate it. Evet, panelimizin sonuna geldik. Çok teşekkür
So we are in the end of the panel. I would like to thank all the panelists for their wonderful contribution. Distinguished guests, we are going to be talking about entrepreneurship, and we are going to invite we are going to watch a movie about the Turkish telecom and the future.